Welcome to Interdisciplinary Case Miles, a podcast where real runner stories meet clinical expertise. We discuss real cases that are anything from weekend warriors all the way to elite athletes, while using our evidence-informed approach.
I'm Dr. Sara Raiser, a running medicine physician focusing on helping runners prevent and recover from running-related injuries while optimizing health and performance.
I'm Kelsey Pontius, a sports dietitian helping runners to fuel smarter, recover better, and help avoid the risk of injury so that they can meet their goals.
And I'm Dr. Mihevc Edwards. I'm a physical therapist and orthopedic specialist, and I've been treating for runners for over 15 years. And what I do is help them get back stronger and better. Hi, everyone. Welcome to Interdisciplinary Case Miles. We are so excited to have you back. And hi, Kelsey. Hi, Sarah. It's been a little while since we've recorded, so it's nice to see you both.
You too, Kate. Good to be here.
We always have fun before we start this. There was lots of laughter, and hopefully it'll continue throughout the episode. But we're going to jump right into our episode. So today we are going to talk about a case of somebody that has metatarsal pain, so pain in the forefoot. And this person is in their mid-20s. She's a recreational runner, and she just moved to a new city. So she's been a runner, but she hasn't really run as much as she's doing now because she recently joined a run group in town so that she can meet new friends. And so she's upped her mileage a bit, and she's just really starting to get this pain in the forefoot. So she ignored it for a little while. She wears heels to work, and she has to walk to work a lot, but she wears sneakers when she walks, but she has to wear those heels on a regular basis. And so she first presented to Sara. So I will let Sara take this forward, and we will talk about this metatarsal pain.
So metatarsal pain, or we like to call it metatarsalgia, at least in our ICD-10s. But it's such a non-specific term and presentation. And in some ways, I think about it like fatigue. It can come from so many different avenues. And so we were talking a little bit before this and all the different routes that this could possibly come from. And really, we have to ask a lot of questions. So we need to ask about training plans. We need to ask about nutrition. We need to ask about biomechanics and do a really comprehensive kinetic chain evaluation to figure out where exactly is this coming from. Kate's already mentioned a couple of things. So walking in high heels, that in and of itself could cause metatarsal pain. Recreational runners joining new groups and potentially getting a little carried away because they're having fun on their runs and doing things that are more intense or out of their norm, or potentially picking up additional days. So those training loads increasing and maybe too quickly could potentially do it. And then biomechanics, nutrition, both super important components to look at as well. So when I initially see this person, usually I'm thinking, well, let's rule out the scary things, and then we'll start kind of sifting through where we need to go from here. So a couple of the first things I'm going to do is evaluate for bone stress injury, make sure the neurological exam is normal. Potentially we'll get an x-ray if my exam is concerning enough. X-rays for the feet, like the knees, I think we've talked about this before, I really like because it gives us an idea of what their mechanics look like and what their bone anatomy structure looks like, at least statically. And so I do think there's value in potentially looking at the bone and looking for a stress fracture, which most stress fractures are not going to show up, but metatarsals can be a good place for them to potentially show up, given that they're longer bones. We may see them in the metatarsal shaft. But I can get a lot of information just from the x-ray. And so I usually have that conversation. You know, we don't 100% have to get them. However, we can look at, potentially look for a stress fracture as well as looking at more of what the structure looks like. So that's where I start. Do they have pain with a single leg hop? Do they have pain on a daily basis? How much is it interrupting them? Or is it just kind of an annoyance that they notice every now and then? So looking at how much investigation we need to do into finding out, is this a stress fracture? Is this a nerve problem? Is there something else we need to do from an interventional standpoint from my side? And then if all that is looking clear and symptoms are relatively mild, then I start sifting down the other paths and looking at what they're doing from, a social standpoint and what they're doing for their job and how they're commuting. Are they walking in these high heels all the way to work? And then figuring out where we can start making some change. So maybe I'll pass it back over to you, Kate, if you want to extrapolate on that a little bit, and I can certainly add in some more tidbits as well.
Yeah, absolutely. So when this kind of client comes to me, if they've already seen Sara, then I'm glad to know that they don't have a bone stress injury, and this particular client didn't. So I will still look just because of my, OCD behavior, if you will. I'll still check it out, make sure, because another set of eyes is always good. But for something like this, I also want to look at things like how are they controlling their body during running? So what do their gait mechanics look like? When we're thinking about the foot and the ankle, we have to think about how is the foot landing? Are they landing on their forefoot all of the time? If they're really landing on their forefoot and they're not moving through that pronation, supination movement, then they're probably loading those metatarsal joints a lot more. So I'll look at that. I'll look at how does their calf muscle look? Is it really, really tight? Are they up on their toes when they're walking? Because if they're wearing high heels during the day, then they might actually have a really tight gastroc or soleus complex that makes it so that they can't put their heel all the way down, which will further load the forefoot. So these are kind of the things that I'm looking at. And I'll look and see, make sure that they have good hip extension, of course. Look and see if they have hip drop. Look and see if they have, femoral internal rotation and knee valgus. What does their arm swing look like? So that'll be part of my initial evaluation. Then I'll actually feel the foot and see what is the mobility? Do they have good joint mobility in the talocrural joint or the subtalar joint? Do they have good mobility in the metatarsals? Are there any sharp areas? What does the neural mobility look like? I'll look between the toes at the interossi because something that comes up sometimes is like Morton's neuroma, and that presents differently in the forefoot. It's like pain and tingling into the second and third toes, but a lot of times people aren't sure which it is. So I'll look at that. And then, of course, I'll talk about their shoes and think and ask them, what kind of shoes are you in? Are you in shoes that are compressing? Are they wide enough for you in the actual foot? Are they too rigid? So maybe this person transitioned to a carbon plated shoe or a nylon plated shoe, and their body wasn't ready for it. They didn't have the strength in their arch or the rest of their leg. So those are definitely questions that I would be asking. And the last thing that a lot of people ask me when they have forefoot pain is, should I wear metatarsal pads in my shoes or should I get orthotics? And the thing is with metatarsal pads in your shoes, they can help or they might not help. And placement does matter because if you put them directly where your pain is, a lot of times it makes the pain worse. But if you put them more proximal or kind of behind where the pain is, they can be helpful. But it just depends if you're comfortable with them in your shoes or not. Like I don't like them in my shoes, so it's not comfortable to me, but it might be to somebody else. So I might suggest toe spreaders instead, or I might suggest that they get a temporary orthotic if that feels good, or maybe just switch out to a new pair of shoes that has a wider toe box and maybe a little bit more cushion. So that's where I would start. I'm going to pass this on to Kelsey. There's plenty of other things, just like you, Sara, that I can talk about, but I think that's a good starting point.
Yeah, I think I'm going to hone in on the age of this client and, really say that this person, I don't know why I said she, it could also be a he, but this athlete might be single. And a lot of times people that are not cooking for families or partners, one of the things they say to me is that they don't feel justified cooking a nice dinner for themselves. And so if anyone has ever heard of the trend girl dinner, which is essentially getting home from work and then throwing together, random things, that isn't necessarily a performance plate. And if you've been following me, you know what a performance plate is. It has carbohydrates, protein, carbohydrates, and color. And so if you're going home and just eating anything for dinner because you're cooking for yourself, or a lot of times people tell me they don't know how to cook for one person, or they're living in a city and if they're commuting to the grocery store, this is really big, they can only carry so many groceries at a time. And so they're only buying food for like 2 days. So now they're having to build into their schedule on top of now going to run groups and work and everything of when they're going to go to the grocery store if they're not doing a haul like somebody that has a car would do. And then a lot of times when people are trying to get involved with these social running groups, they're not clocking necessarily that now they're going from just being casually active. This is a little bit different than going to Pilates twice a week, to now they're training like an athlete. They're doing speed work. They have a long run. And a lot of times they ramp up super quickly. And obviously, this has implications on Kate and Sarah's side. But on my side, they're not necessarily thinking, hey, I'm doing more. And now I'm going from being just generally healthy to training like an athlete. And I need to fuel like an athlete. Also, it's very possible that they've never been exposed to what does fueling like an athlete even mean? Because most of the information around nutrition isn't that of how to fuel like an athlete. It's essentially, I hate to say this, but it's essentially how do we control the size of our body and how do we prevent chronic disease, which that part is important. But there's definitely a balance between training like an athlete and trying to eat so that your insides are healthy as well. And so I would be working on what that looks like for an athlete, not to mention all of the messaging around the fiber and protein is important. Those are buzzwords right now, but it tends to be a lot of times what's shared on social media where I could see someone of this age group getting really intertwined with and not necessarily enough carbohydrates or quick available fuel sources that are convenient for someone that's working and that's doing all of the cooking and cleaning themselves. So I could see convenience foods being helpful for this specific person. So yeah, I would want to just understand a little bit more about their current eating habits and why they choose the foods that they do, because that's likely going to really, really help them get out of this.
I recently had a conversation with someone in the same a similar scenario where they're like, I don't really feel like I can cook a big meal for myself. It's just me.
Yeah.
And I'm like, well, maybe we can talk about planning for the week. And if you don't mind eating some of the same things sometimes, being able to cook a reasonable size, and then you've got dinners for 3 nights, or you've got ways that we can kind of mix it up and change what you're eating. And so I've had some of the same conversations because that's certainly come up in my clinic as well. It's really common to perimenopausal. I have a number of folks who are just like, I just kind of don't bother kind of thing. And I don't want to eat too much. I don't want to prepare too much. So those are big conversations from that perspective when it starts coming to osteoporosis and more the bone health. And I've gotten total T3s on some of those folks, so 50s, 60s, that are incredibly low. And so it oftentimes is very helpful even for folks who are maybe not doing, large volume of running, that I still see a lot of correlation to. So a little bit of an aside, one thing I thought of while you were talking, Kate, is when we were talking about nerve conditions, back is a big one. And I remember earlier that I got burned a couple times because someone came in with foot pain and were like, it's got to be foot pain. And in the end, it actually wasn't foot pain, it was the back. So you're mashing around on their foot and you're like, I can't find what's going on. I can't reproduce it. But then you do some things like stimulate some neural tension, or you ask, do they have back pain? Which I ask almost every single client I see, and I have them do lumbar mobility regardless of what we're seeing them for. And sometimes things sneak up, as you know, Kate. So occasionally I have jumped all around the foot trying to figure out what's going on, and it turns out it's not even there. It comes from the back, and that can be really sneaky, that like ball of the foot pain. Sometimes they'll describe it as burning, numbness, tingling, but sometimes they don't. Sometimes it just feels like the pressure, and when they're walking on it is when it bothers them. So certainly can show up in a lot of different ways as well.
Yeah, and that's right. So every time I do an evaluation, as you both know, and if you've been listening to this podcast, I look at everything. So I'm already looking and ruling in or ruling out back pain. I teach my students all the time that if you don't look at the back when you're looking at the foot, you're definitely going to miss a percentage of the cases. Because even myself, like last week, I have back pain that comes and goes sometimes. And I was having pain in my foot and I was thinking it was plantar fasciitis, and it's me. And then finally I'm like, oh, you're such an idiot. It's your back, And so it's such a funny thing, but because you don't associate the pain with something so far away a lot of times. So it is something you definitely need to roll in and roll out. And there are a couple other things I wanted to say in terms of, we didn't really speak to the training load quite as much as we normally do, but and something that you said, Kelsey, about transitioning from just like a person that exercises to an athlete, that's a huge mindset shift. And a lot of people don't really believe they're athletes, even if they're running 3 times a week. And so sometimes that discussion and having that discussion with the athlete and saying, like, look, you are an athlete if you're doing what athletes do, which is running, lifting, doing speed work, doing long runs. That's all athletic stuff. And so making that mind shift is really important, because once they can shift their mindset, then they're more open to fueling appropriately. They're more open to going to the gym and doing the strength exercises that I'm going to inevitably ask them to do, or the plyometrics, you know? So I thought that was a really interesting comment, Kelsey, that you made. And I just wanted to highlight it because it's so important.
Yeah. Yeah. I think too, like growing up and playing sports and everything, not everybody has that opportunity. And so it could be their very first opportunity to be exposed to that. And they haven't realized or have the privilege to, before this point, to say, hey, I need to be treating myself that way. And sometimes it's kind of like, they think I'm like stroking their ego by saying, no, you're an athlete. These are hard things. You're asking your body to do hard things. And so we have to give your body the resources to do the work that you're asking it to do.
I was at a conference earlier this week and had 2 sessions that I had to give and multiple things I had to be at. And I literally planned my nutrition around the day. And I tell you what, it made a huge difference. Oh, it's huge. Like, I made sure to get nutrition at certain time points. I mean, cognition is a huge piece of it too. And so everything you do, nutrition matters. It's foundation, right?
It does. I always know that if I travel with Kelsey, I'm going to be good because she reminds me.
I just so many non-controllables to life. You can get delayed in flights. There can be weather. There can be all of these things. You can get sick. Like Sarah and I are fighting a cold right now. And it's like that alone makes you not feel good. But if your nutrition is good, then that's one controllable variable that can make a significant impact.
Yeah, for sure. All right. The other thing I wanted to mention, which I started to mention before, was training load, just because I do think this is important for somebody who might not be considering themselves a runner and just starting with a run group. Training load is how much load we put on our body. And we have to consider walking to work, being up on our feet all of the time as part of training load. And a lot of times we don't think of that. So if you've just moved to a new city, and you've started to walk to work every day, that's exciting. That's good for you. But that counts towards mileage sometimes, especially when we are doing that now, joining a run group and becoming part of this structured program where we're running, 2 to 3 to 4 times a week, and probably distances that are more than you were doing, or you might be running faster than you typically do because you want to talk with the people that you've met. And then also adding different types of workouts. So a lot of things that happen with injury come back to training load, making sure that your body can handle the load in which you put upon it. And so that's being able to handle the load that you put upon it from a nutrition standpoint, from a stress standpoint, both physical and mental, from a strength standpoint, and also just an overall training load. So I think that we have to remember to consider that when an injury comes up.
It reminds me of one other thing. I end up taking care of a lot of college students, and they can do a ton of walking and not even realize it. And I actually had one athlete, one of the differentials with metatarsalgia is something called Freiberg's infraction, which is basically a bone stress injury at the end of your second metatarsal. But it could be really tough to heal and come with consequences like early osteoarthritis. And so we don't want to miss it. And I had a young man who was a college student who dealt with this. And one of the things we had to do is really rein in his walking. Of course, we booted him and unloaded it for a period of time too, but we really had to talk about how much he was doing on campus as well, and ways to get around that. And there are some ways to do that. Sometimes it's getting on a knee scooter, or it's getting rides around campus, getting a handicap pass. And so those things can be really reasonable things that can make a really big difference if you can adjust them in your lifestyle too.
Yeah, absolutely. And you have to decide what you want to do. Do you want to walk to work and run? Great. Maybe we just do one of those things to start so that we can ramp up our activity.
And this can seem overwhelming. So having someone in your court, I think, is really helpful, like Gait or Kelsey.
Yeah. Kelsey, were you going to say something?
No, I was just going to say a lot of times just having someone in your corner and like so that it almost lets you get away from your own bias that like you're not lazy, you are doing a lot, or you can work up to this amount, but you're not there yet. I find as an athlete that's really helpful, even for myself, because again, like I'm the worst at being like, no, you're lazy, park far away, who cares?
I know, me too. All the time, I'll be like, oh, how can I add something to my day so that I'm getting more activity, whether it's walking up to, the bus stop to get Andy or to get my mail or whatever it is. And after a while, it does add up and you don't realize that, oh, I've walked 4 miles with the dog this morning, plus all this to do something else. Plus I've run and I've exercised. It just adds up. So, all right. Well, guys, I think this is a good way to look at metatarsal pain, knowing that we have to rule in, rule out what it actually is, which is something we talk about all the time, right? And then some of the things that we have to think about around this pain. Are there any kind of last minute tidbits that either of you want to make sure to share with the audience? Kelsey, you want to go first?
Yeah, something my mentor always says is if you can feel it, you can do it. And so obviously it's more than just fuel, but I think that like the whole message of this whole episode was just making sure that your body can handle the stress that you're putting on it from so many different angles. So it's sleep, it's load management, it's nutrition.
Sara?
Yeah, and from the physician's side, I know oftentimes one of the questions that comes up with these episodes is how do I find a doc who understands runners? And a couple things that you can use when you're in that visit is looking at, do they look at you when you're standing? So they looking how the foot is being used and kind of looking at overall mechanics. But then also, are they asking these global questions? So more than just x-rays and pushing on your foot, they should be doing a lot more in terms of looking at how you move and then how what your training loads, recovery, nutrition, all those things look like and setting you up with appropriate providers accordingly.
Great. And I think for me, what I want to really highlight is that you could put a metatarsal pad in. You could, change your shoes or get a pair of orthotics, but that's not going to fix the problem because it ultimately comes back to how strong are you? Can you tolerate the load in which you're putting on your body? And what is your fueling? What are your biomechanics? What do they look like? How is your foot hitting the ground? And are you on your forefoot? Are you just loading that area too much? So for me, it comes back to load and how your body handles it. All right. Well, thank you everyone for joining us again. We are so happy to be here. One of my dogs is now coming in view. If you are, if you can.
Hi, Gus.
It's Gus. He wants attention. It's not good. But anyway, if you liked this episode, if you are interested in having us go over a case of yours, you can always email us at runCaseMiles@gmail.com. If you like this episode and learned from it, we would love it if you would pass it on to your training partners, coaches, friends, other medical providers, because that's how this podcast grows and how we can continue to help people that have questions about running. So thank you so much for joining us, and we will see you soon.